Well, the new year always brings resolutions to take charge of your health, right? And if you're one of the millions of Americans looking to lose weight or eat just healthier this year, whatever your goal is, the important thing is that you are on the right path to achieve it. So on this Wellness Wednesday, Dr. Natasha Bhuyan, National Medical Director for One Medical, is here to help you with your health. You know, it's time and time again, we always have great intentions. We want to make these resolutions, but it is always so hard. So where's a good start? How do you start to keep your resolutions?
Right, you're so right, because 90% of Americans that make a New Year's resolution, within 4 months, they don't stick to it.
4 months? I even think that that's a long time.
But it's like so many people don't stick to it. There are ways to be successful though. So the number one thing I tell people is set specific goals. A lot of people say, I want to eat healthy, I want to lose weight, but what habits are you going to do to help yourself achieve those goals?
Yeah.
So set specific things like, I'm going to eat cauliflower rice instead of white rice, exactly. Or I'm going to cook 6 nights a week, I'm only going to eat out 1 night a week. If you're specific, that's very good in getting successful goals. The other one is be realistic. A lot of people this time of year, I see my patients buying exercise equipment that's really expensive. They're joining gyms that's really expensive. And a lot of people, they haven't exercised before. And so the secret to making sure a habit sticks is less is more. If you set small goals, you're more likely to be successful. So even exercising 5 minutes a day, it does have an impact. So you can say, I'm going to start with 5 minutes, and the next week I'll do 7 minutes a day, and then the week after I'll do 10 minutes a day. And make sure that you're tracking your progress. You don't need to be perfect, but as long as you're doing more than the week before, you are moving forward in the right direction. The other tip that I tell people is make sure your resolution is something you enjoy. If you hate running and you say, I'm gonna run a mile every single day, you're of course not gonna stick to it. So instead, do other health goals like dancing or riding your bike.
Something you enjoy.
Something you like doing. You're way more likely to be successful. And then the last tip I tell people is make sure that you reward yourself. So after a week of sticking to your resolution, have a reward. After a month, after 2 months. But the big thing here is the reward should not be the habit that you're trying to change. So here's what I see. A lot of people are trying to eat healthy, and then they have cheat days as a reward.
Exactly.
So they eat healthy and then they indulge
They're gonna
in
have that pizza
and chocolate cake. And that's not really a good habit to get into, because then you have this dynamic of depriving yourself and then binging. And so that's not good, because it's all about moderation. So instead, the rewards should be things like you get a bubble bath if you stuck to your resolution, or you get a massage, or you can spend time with a friend.
Something that's good for you.
Something that's good for you. So just like don't indulge in the bad habits that you're trying to change.
Exactly. No, that's so good. And you know, you talked a lot about the physical things, and I know that, you know, the next couple of tips, you've actually told your patients when it comes to physical health.
Yes, there's a couple of resolutions that I like to tell people that have a huge impact on your health, and they're pretty easy to achieve. So one of the big things I hear from people on why they can't stick to resolutions is they don't have time. I don't have time to cook healthy. I don't have time to exercise. So I tell people, add a couple of movement minutes to your day. Just 5 minutes of high intensity exercise has been shown to reduce your risk of heart disease in people who are sedentary. So that means you can do a 5-minute burst of sit-ups in between meetings, or you can do 5 minutes of jumping jacks. So those small things have a big impact. The other thing I tell people to do is cut back on sweetened beverages.
Oh, I'm guilty of that too.
It's a hard one to stick to, but if you reduce it by, 1 drink a day, by 50% a week, and then by 70%, you can actually reduce your risk of diabetes if you cut back on sweetened beverages. And then here's a really important one. So if you had to just pick one resolution that has the biggest impact on your health, I tell people, eat 30 grams of fiber per day. This one is amazing. There's really great research on if you eat 30 grams of fiber, it helps you lose weight, it lowers your blood sugar, and it lowers your cholesterol. We don't get enough fiber in our diet, and this one people can stick to. It's very, very practical. So if you had to pick one, the fiber is the one that I say to go for. There's other ones too, like drinking more water. We don't get enough water. It affects every single organ system. So 1 more glass of water a day helps your skin, helps your digestion, helps your joints. And so I think there's a lot of things that people can do to improve their health that doesn't have to be totally backbreaking.
Okay, I'm gonna stick with the fiber. That's something new I've never done. I really like that.
It's easy,
Ooh, Natasha, great tips that are tangible.
Tangible, of course.
I appreciate that. Happy New Year.
Happy New Year to you too. And then of course, the other thing I also tell people is not just focusing on your physical health, but your mental health as well. Think about things like improving your sleep, reducing social media, going outdoors. All those things can actually help reduce your stress levels. So think about your physical health and your mental health.
So key. All right, thank you so much.